So you've probably heard of phrases like neurodivergent or on the spectrum. These phrases are sometimes related to autism or autism spectrum disorder. Hi, I'm Michelle Young, licensed clinical social worker with Mental.Health.Merienda.
And I'm Dr. Adeline Leon, licensed clinical psychologist. So, autism or autism spectrum disorder, ASD, refers to a broad range of conditions that are characterized by challenges with social skills, repetitive behaviors, issues with speech, and nonverbal communication.
So, on average, autism is diagnosed around age 5 here in the United States, but symptoms of autism can appear as early as age 2 or 3. So, some common signs of autism in babies, what you're going to see is limited or no eye contact. So that's a big one. If you have a baby, if you're noticing that they're not looking at you, they don't seem interested in looking at your face, that's usually a big sign of autism. And then another one in babies would be just very few or no social interaction type characteristics, like they're not really smiling at you. They don't seem very warm. It's almost like they seem kind of cold towards you. You don't see a lot of that joyful expression in their faces. So that's another common sign in babies. And then in toddlers, some of the things that you'll see are, again, very limited or no babbling, delayed in speech. So they're not saying the words that you would normally say. If you call their names, they're not responding to it. It's almost like they're ignoring you or they're not listening. And then oftentimes with toddlers, you have that kind of back and forth, like they want to show you something. You don't see that with kids, with toddlers with autism. They're not pointing at things to try to get your attention. Again, almost kind of seems like they're kind of cold, like they're kind of ignoring you. You tend to see that a lot. And then again, like when it comes to communication, like few words, you definitely notice that there's a speech delay. You notice that they're not saying as many words as you would expect them to say at that age.
Yeah, so I think it sounds to me like some of those key signs are that lack of interaction back and forth. Because even with babies, sure, they don't speak, but they still have eye contact with you, like they still smile in response to things. And so you don't have that interaction back and forth.
Yeah, definitely. And those are those key hallmark signs of this disorder. Again, the social interaction and communication.
And so while society is much more aware of autism today than ever before, thanks to improved public health outreach and increased screening, there are likely many adults with autism now who never received a diagnosis or maybe misdiagnosed with something else. And so getting a diagnosis for autistic adults in particular can be really hard because they learn to what's called mask or hide their autism symptoms. So when it comes to masking, it's a way that autistic adults learn to practice and perform certain behaviors and hide or suppress others in order to appear neurotypical in social interactions. And so they might observe how other people act, and maybe that's not the way that they would act naturally, but they can imitate that. They can kind of blend in with other people, and then things that are maybe not neurotypical that they don't see other people doing, they hide and they suppress those parts of themselves.
Yeah, and that can sometimes cause other, self-esteem issues and other mental health concerns. But as I said earlier, the hallmark signs of autism are going to be those challenges with social communication, and then also something called repetitive behaviors. And you see this with children and with adults. So some common symptoms and traits of individuals with autism. So if we're talking about social interactions. So sometimes with adults who struggle with autism, they might mention feeling awkward in social situations, having difficulty understanding how others are thinking and feeling. So social cues. So understanding social cues is going to be something that's often a challenge. And sometimes what you'll hear from adults who are autistic is that they actually prefer to be alone. And you probably see that, maybe they kind of seem like a loner, but oftentimes there's a preference to be alone. And just in general, difficulty making friends is something that we hear.
And then verbal and nonverbal communication are also impacted. So difficulty making eye contact. And I think in natural conversations, it's not necessarily someone who makes no eye contact. It's someone who has either no eye contact or very limited, restricted eye contact, which is not what's typical in a conversation with someone, at least based on cultural norms. Responding to conversations in a blunt way. So I think a good example of this would be, Michelle, for example, if you're wearing a blouse and if I don't like your blouse and you ask me what I think of
Rude.
it, I wouldn't. Of course, I love everything that you wear, but if I didn't like it, then I might say, oh, I think this other color looks better on you, or I think this other blouse that you wore looked better. But in someone with autism, they would say, that looks terrible. And it doesn't really seem to someone with autism, that's kind of following a social norm. And it doesn't really seem to make sense to them because, well, you asked me what I think and I'm telling you.
Yeah.
What's wrong with you asked
Yeah.
me? Why did you ask
Yeah.
me? So it's just the not understanding and not following those social norms. And so a social norm is that you wouldn't tell someone that something looks terrible, even if they asked you. I think things like that you can see very often. And so another one related to that is taking things literally. And so like not understanding sarcasm would be related to that. That's a big one. For example, I am known for not being very on time to things. So if I tell someone, oh, I'm running a little late, and they say, oh, wow, that's not like you at all, then that's clearly sarcasm because actually that is very much like me. And so not understanding that, I think, would be a good example of that.
Yeah. Again, it's kind of coming back to the social cues or learning how to read the room. That can be really difficult for people with autism. Another thing would be repetitive behaviors. So sometimes you might see this with kids where they're doing something called stimming. They might be like kind of like flapping their hands. So you kind of see like those repetitive behaviors. In adults or in older people, you might see that they are very particular, actually. So they thrive off of routine. So they might be someone who maybe eats the same thing for breakfast every day for many years. And they always have this routine. And routine is often like something that helps them. Also, something you might notice with people with autism are having very intense and specific interests. Like an example I can remember with kids that I've worked with is, being really into dinosaurs. So like everything is about dinosaurs. Anytime they can talk about dinosaurs, you might be talking about something else, and then they'll somehow bring up dinosaurs in the conversation. And and again, that kind of goes with the whole social cues and not reading the room. That not everybody wants to talk about dinosaurs all the time. But
It's
they all
probably
know
hard to
even
kind of weave that into a conversation
I know,
and
right?
talk
Like,
about
oh,
dinosaurs.
dinosaurs. Yeah.
Yeah.
Or trains. Dinosaurs and trains were like two really common ones with kids that I used to work with. But they would know like everything about dinosaurs or trains or whatever specific topic to the detail that most people would not maybe know about or even find interesting. So that's also something that you might see in individuals having that intense and specific interest. And then another area would be sensory processing. So kind of going back to like that stimming behavior is kind of related to this, but sometimes people with autism have sensitivities to sights, sounds, smells, and touches. It could even be like sensitivity to how their body is moving. So again, that kind of like stimming behavior is related to that. Or even like their balance, or even their internal body cues. So you see that there's a lot of sensory processing sensitivities.
And so, with all of those sensitivities, that can result in sensory avoidance, which is trying to get away from things that most people can easily tune out. And so, sensory avoidance, it could look like pulling away from physical touch. If someone goes to hug you and you're kind of, oh no, don't do that, pushing them away, even covering your ears to avoid loud or unpredictable sounds, avoiding certain kinds of clothing. So, like a concert, for example, would probably not be a great experience for someone on the spectrum. Although for most of us, if it's an artist that we like, then we would really enjoy it. But that crowd and those sounds and those lights, that would likely be very distressing.
Yeah. Something that's common with kids is, if you have a tag on your shirt or on your pants, we can easily ignore that and not be bothered. But there are some kids and maybe some adults too, where that touch, like they can't even concentrate. Like that touch of the tag is going to bother them the whole day and make them feel like they want to crawl out of their skin to the point where they have to do something about it. So that's another example of that, those kind of the sensory processing issues.
Tune into our other videos for more information about autism as well as other mental health conditions. Thanks for watching.
Bye.
Bye.